Hello friends, welcome back to the part 2 video of Rhineck or else acute torticollis. As I explained in the previous video, acute torticollis is a condition in which due to tightness of the muscles of your neck region, your head is pulled towards one side while as your chin is rotated towards opposite side. If you haven't checked that video till now, please check that video, understand what is Rhineck and then come to this video. Because in today's video, I'm going to explain to you how a physiotherapist can help you out in managing Rhineck and also some tips that you can follow if you are suffering from Rhineck. And if you haven't subscribed to this channel till now, please consider subscribing because every single Monday I come up with videos that are educational, inspirational and informative that are meant to boost up your health motivation. So let's get started and understand how Rhineck can be managed with the help of physical therapy. When the cause of Rhineck is purely muscular, that means when there is no underlying other pathology like tumors, infections, etc. The good news is it can be easily managed with the help of physiotherapy and with the help of some exercises and lifestyle modification that can be easily done at home. So what are these exercises and what are the methods that physiotherapists will use in order to manage Rhineck? Let's see. Once you visit to a physiotherapist's office, what he will do is undergo a complete examination of your neck muscles, which will include the checking of the level of the strength of the muscles, the tightness of the muscle and available range of motion in your neck and shoulder region. Followed by this, he will design an exercise program as well as a management program in order to achieve the results in terms of increased range of motion, reduction in pain, reduction in muscle spasm and improved flexibility of neck muscles. The treatment methods that he will usually use will be comprising of thermal therapy like hot packs or cold packs or some electrical modalities, use of passive stretching methods in order to maintain the flexibility of the neck muscles, strengthening exercises and deep myofascial release techniques or massage therapy techniques. Also give you some advice on lifestyle modification, postural correction and some do's and don'ts that you need to take care when you are undergoing physiotherapy treatment. So now it's time for top 5 tips that you can use for managing your cervical torticollis. But please ensure you visit your doctor before you start any of the steps or any of these advices that I am going to share with this video. Get yourself diagnosed and then only start with any of the procedures. Tip number 1 is as usual my favorite, that is thermal therapy or else hot or cold fermentation. Now you can use many ways of hot pack or cold pack application. I have made some videos which will explain you more in detail. I will attach the links to the description box so you can go and check that video out. But for today, I have one more nice idea that you can use to apply hot or cold fermentation to that neck area. So what's that? Take a towel, something like this, or else a napkin, roll it, dip it in a hot or cold water, whatever you are comfortable with. If your pain is very acute, that means it's less than 48 hours, go for cold fermentation. But if your pain is more than that, that means if your pain is more than 4 or 5 days, then go for hot fermentation. You need to just dip this towel roll or else a napkin in that water. Once you have dipped it, you just need to squeeze it and then you need to just keep it in your neck region like this and just shake it front and back, front and back, front and back like this. This will relax your muscles, especially the muscle that is got spasmodic, that is tight, and it will release it. Focus on more shaking movement to the muscle and the side which is more tight, and it will help you out in gaining some relaxation. Number 2 is neck stretches. Here you need to understand which side of the muscles are tight or which you find difficult to move. For example, if the tightness is in your right side, you need to focus on moving it on the opposite direction. So if your neck is rotated to one side, you need to try to rotate with the help of your hand to the opposite direction. Hold this for some time and then come back. If your neck is rotated or bended like this, and this is the position of torticollis, you need to do just opposite. That means rotating your neck to this side and then passively pulling. This needs to be done passively. Come back. Tip number 3 is to give massage to the neck region. So how do we do that? So there are 3 methods that you can use. So one is the circular method, where you are doing circular motions to the neck region wherever you feel tightness. So it should be 10 times circle and 10 times anti-clockwise. Next method is petrissage. What do I mean by that? Just have a look. You need to grab a big bulk of muscle and just pull it and release it, pull it and release it. So doing this will help you out in releasing the muscle, increasing blood flow. So take a thick chunk of muscle between your fingers and thumb, hold it, pull and release, pull and release. You do it opposite direction. Since the sternocleidomastoid muscle is affected, you can give this method, you can use this method for that itself. So just try to grab the muscle, pull the belly of the muscle and then release, pull and release. Start doing it from neck region and keep going down. Method is deep friction massage. Here what you need to do is you can take either help of 2 fingers or 3 fingers. Keep it to the area of pain and tightness, and you have to just do friction based movements, that is to and fro movements, for some time. Maximum you can do this movements is for 10 to 15 minutes. And tip number 5 is exercises. Yes, exercises can help in reducing pain and the spasm. So for long term, yoga and Pilates methods are some good methods that can help in managing the spasmodic torticollis for a long period of time. But there are some other exercises that totally focuses in your neck muscles that can help out in reducing the pain and spasm. So what are these exercises? Let me show you. Exercise number 1 is just flexion and extension, or else bending, forward bending and upward bending of your neck region. How do you do that? You just need to keep your hand forward, try to give some resistance and bend your neck forward. Same way, you need to give some resistance to your back and then push your neck backwards. You can do this twice or thrice, or as maximum as 5 to 6 times in a day. Next exercise is shrugging of your shoulder. Here what you need to do is take some weights in your hands. It could be either a dumbbell or else just a water bottle filled with water. You can go as maximum as 1 liters of water bottle to 1.5 liters of water bottle. This you need to keep it on your hand, and you need to just pull your shoulders towards your ears. Hold it for some time and then just come back. You can do this 10 to 15 repetitions twice in a day. Next exercise is shoulder retraction. What do I mean by that? Here your shoulder blades needs to be retracted or pulled back. How we can do that is just keeping a hand in front of a wall and just trying to retract or bring your shoulder back, or else try to press your hand towards the wall without bending your elbow. Exercise is bending the neck towards the side where the spasm is there and then just coming back. But when you come back here, to give some resistance with your hand, hold it for some times and then relax. Again bend your neck towards the side of spasm and come back while giving some resistance. So guys, these were all exercises and tips that would be helpful for you to gain some maintenance and improvement in your torticollis levels. And as usual, the discussion happens at my Facebook group. The name of the group is HealthQ. If you have got any queries related to this video or any content that I come up on this channel, please don't forget to join my free Facebook group group. The name of the group is Health Q. Also friend, I have got this brand new website. The name of the website is www.meadowhealthconnect.com. Don't forget to visit that website because there are some amazing blogs, amazing stories that I'm going to update every single month that will boost up your health motivation. So on that note, let me tell you, bye-bye.